People who are more isolated than they want to be from others, they are less happy, their health declines earlier in midlife, their brain functioning declines sooner, and they live shorter lives. At any given time, more than 1 in 5 Americans will report that they're lonely. You can be lonely in a crowd, and you can be lonely in a marriage. So the second big lesson that we learned is that it's not just the number of friends you have, and it's not whether or not you're in a committed relationship, but it's the quality of your close relationship. And living in the midst of good, warm relationships is protective. At age 50, it wasn't their middle-aged cholesterol levels that predicted how they were going to grow old. It was how satisfied they were in their relationships. The people who were the most satisfied in their relationships at age 50 were the healthiest at age 80. Good, close relationships seem to buffer us from some of the slings and arrows of getting old. Our most happily partnered men and women reported in their 80s that on the days when they had more physical pain, their moods stayed just as happy. And the third big lesson that we learn about relationships and our health is that good relationships don't just protect our bodies, they protect our brains. It turns out that being in a securely attached relationship to another person in your 80s is protective. That the people who are in relationships where they really feel they can count on the other person in times of need, those people's memories stay sharper longer. And the people in relationships where they feel they really can't count on the other one, those are the people who experience earlier memory decline.